ACL stands for anterior cruciate ligament, and it is a main ligament inside the knee. It is very commonly injured in sport, especially skiing, football, soccer, basketball, things that involve a lot of quick turns and twists, quick stops. That's when the ACL gets torn. It usually occurs in young, athletic, active patients.
Well, it was playing softball, first base, and they kind of overthrow me a lot. So this time I jumped up to try to catch it and just came down and on my knee wrong, and I could tell just immediately that probably tore it.
David was kind of a typical weekend warrior type of athlete who was playing softball, and it only takes one misstep and felt a pop, knew there was something wrong with the knee, didn't feel right, didn't feel steady, examined him, got his MRI. He had a classic tear of the ACL.
With Dr. Aldrich, he's a cadaver ligament, and the recovery time was less, and I was back, being active a lot sooner. One
of the advantages of using an allograft or a donor tendon is that you don't have to take any tissue from the patient. So it actually can be done almost entirely arthroscopically. We're talking about two tiny incisions about that big, and then one other very small incision to put the graft in. And that's it.
And then after the surgery, I worked my way back up through this therapy and stuff. But 1st of December, I went snow skiing, and that was right in the 6-month period.
He definitely wanted to be active again and run and jump and do those things, and he was in his 30s, and so we scheduled him for his ACL, and he did extremely well. He was very diligent about doing his therapy and also not pushing it faster than we wanted him to, and holding off on running and sport until he was ready. And now he's back doing anything he wants to do.
My knees are very important to me, and not having the limitations of having a knee issue with them. So getting them repaired was very important in the fact of the activities that I do.